May I please have your first name and date of birth?
Yes, Mary Rose, and my date of birth is November 15th, 1998.
1998. Okay, Mary Rose, so I see that you've been complaining about some heart palpitations and tightness in your chest. Okay. Anything else bothering you that I should be aware of?
Sometimes after I go swimming, I get this sort of ringing, pounding in my ears.
Okay.
Just it's uncomfortable, just a wall in my ears. Sometimes I have difficulty falling asleep as well, or waking up feeling rested.
Okay. And when is the last time that you've had a head-to-toe assessment performed?
It's been a few months.
A few months, okay. When did these symptoms begin?
So the heart palpitations are probably the last month or so. The ringing in my ears has probably been the past few months.
Okay. So at least a couple of months.
Yeah.
Any pain in your body while you're experiencing those symptoms?
Mostly the pain is in my chest. It's just sort of a tightness.
Okay. And the tightness in your chest and the ear ringing, did they happen at the same time?
Often after exercise. So every time I exercise, I get the tightness in my chest. And every time I go swimming, I get the ringing in my ears.
Okay. And how often would you say you're swimming?
About 3 times a week.
3 times a week. Any tingling sensations in your body, your scalp, your feet, or your legs while you're experiencing those symptoms?
No.
Okay. And on a scale of 1 to 10, how intense is the tightness in your chest?
Probably a 5 or a 6.
Okay. All right. Have you noticed any discharges in your ears? Any liquid or any, anything coming out of your ears?
Well, sometimes after I go swimming, I'll sort of shake my head and then a little water will come out. But that's always been the case.
Okay. Okay, so let's go ahead and check your vital signs. I'm going to set this aside for now. And I'll be asking you questions throughout the examination as well. So I'm going to first start by taking your temperature to get a baseline of just where we stand on that. So this is going to go over your forehead and behind your ear. Wonderful, 97.9, so you do not have a fever. And let's check the level of oxygenation in your body. May I please have your index finger? Set this right there, and you can just relax your hand. I'm going to go ahead and listen to your heart and lungs. Just breathe normally, just taking a listen at your heart first. Checking for any murmurs, no skipped beats. Okay, normal sounds, S1 and S2 are present. I'm not hearing S3 and S4. And I listen with the bell side as well for the more superficial sounds. Okay, good. Okay, so heart is normal. I'm gonna go ahead and auscultate the lungs next. Take a deep breath in for me and out. Okay, good. You can just breathe normally now. Wonderful. So no crackling or wheezing. Lungs are clear. Oxygenation is 98%, which is also normal. So I'm going to go ahead and make a note. Temperature was 97.5. Oxygenation. Do you feel any tightness in your chest right now?
Not right now.
Lung exam was normal. Heart sounds S1 and S2 present. Okay, wonderful. I'm gonna go ahead and take your pulse as well. Okay, so just relax for me. I'm also going to pay attention to your respiration while we're here. So about 85 beats per minute. Normal pulse. And your respiration is about 15 breaths per minute, which is normal. Wonderful. You do have very cold hands. Is that normal for you?
Yes, I always get coldness in my extremities, so my hands, my feet.
Okay, good. If that's normal, then there's no cause for concern. Okay, so normal respiration. Okay. And how about your menstrual cycles? Are they pretty regular, normal? Okay. So that's normal. Sometimes a fluctuation in hormones can cause all sorts of complications like heart palpitations, even a coldness in your extremities. But if that's normal for you and if you have regular cycles, then it should not pose any problems. Okay. I'm gonna go ahead and begin the head to toe assessment by just observing your body and making sure that I'm not missing any external signs. So I'm just gonna take a look at you and check for any bruises, lesions, colors that shouldn't be present, abnormal moles. You have quite a big mole over there. That looks normal. The well-defined borders, one color. Do you get your skin checked out by a dermatologist on a regular basis?
Somewhat regular.
Quite good. Yeah, I also have a lot of moles and I have to go in every 6 months and just compare them to the baseline to make sure nothing changed. Good. All right. Let me see the inside of your arm. So the color of your skin is uniform. No discolorations present. No scars, no bruises. No signs of palmar erythema or red palms. Capillary refills in less than 3 seconds. No signs of nail clubbing or pinning. Any joint pain when I press down on your joint?
No.
Good. And let's check this arm as well. Okay, so that looks quite normal. Alright, I'm going to go ahead and assess your head and palpate and check for any lumps or bumps. Is it okay if I undo your ponytail here?
Yes.
Don't want to hurt you. Okay. And can I undo everything?
Yes.
Wonderful. I'm just going to take a look at your scalp as well. And just make sure that I'm not missing anything, or I'm not seeing anything abnormal that you otherwise would not be able to. It's the front, usually you can see when you check yourself out in the mirror, but the back and the sides, not so much. So if there are any skin abnormalities, I will be able to spot them. Oh, your hair is so soft.
I just washed it, so it might be a little damp.
Okay, so that's fine. And this side. Okay. Wonderful. Oh, there's a little more in here. Great. So no abnormal breakages. Just a normal hair distribution on both sides. I'm not seeing any signs of alopecia. Color of your scalp is appropriate to your ethnicity. No patches of hair loss. Okay. Wonderful. No signs of psoriasis or dermatitis. I'm going to take a look in the back as well. I'm not seeing any dandruff. Wonderful. Okay, I'm going to go ahead and palpate your head and just make sure I'm checking for any soft, spongy areas or hard lumps or bumps. Any pain when I press down on your mastoid bone process behind the ear?
No.
not noting any abnormalities of the cranial area. Normal level of symmetry, no lumps or bumps are present. Okay. I'm gonna go ahead and inspect your ears. Normal ear oracle. No discharge is present. Any pain when I pull down on your ears?
No.
Okay. Any pain when I pull up?
No.
Alright, good. I'm gonna go ahead and just feel your face and just touch you. You can keep your eyes closed and just let me know if you feel any pain. Checking for any lumps or bumps, indentations. Alright. Eyebrows are symmetric, good hair distribution, no hair loss. Okay. I'm gonna go ahead and do a little tapping of your face. Okay. Can you open your mouth a little bit? Yes, perfect. Checking your jaw. Good. So face is normal. Okay. Can you look up for me? Taking a peek at your eyes. No sign of any jaundice, conjunctivitis pink and moist. Can you look down? Okay, good. Perfect. Perfect. And can you look forward for me, straight up? Okay, pupils are round and reactive to light, accommodating. Okay, can you look at my nose? Perfect. Okay, can you look at these fingers here and the light? Fingers, light, fingers. Perfect. So, synchronized movements. Sclera is white, pupils are round and reactive. I'm gonna go ahead and palpate your eyes. So keep your eyes closed. Okay. Checking for any lumps hidden in between the superficial level of the skin and your skull. Okay, not present. Okay. Let's check your sinuses. The ethmoid and sphenoid sinuses, and the frontal, maxillary sinuses in the front here, not inflamed. Do you usually get a runny nose at all?
It depends on the time of year. So early spring, I get very bad allergies, and my nose is like a faucet. It'll run all day. But most of the year, I'm okay.
Good. So let's go ahead and check your ears with my otoscope here. So the pressure in your ears, on a scale of 1 to 10, when you feel it, how intense is it? Where 10 is the most pain you've ever felt or the most pressure you've ever felt?
I'd say when it's at its worst, it's between a 6 and a 7.
Okay. So quite significant. So I'm thinking you may have maybe an untreated chronic ear infection that maybe is not causing you too much trouble, but it's present and therefore contributing to the symptoms. So let's go ahead and check your ear canal and tympanic membrane. I'm going to start with your right ear, so if you can move your head towards your left. Let's go ahead and see if I can spot anything in your ear canal. Sometimes untreated infections can just linger for a long time. So you don't have any wax buildup, bony landmarks are present, tympanic membrane is quite clear, no signs of any infection, pearly gray color, so no infection. I'm going to go ahead and check this other ear as well. Okay, so your right ear looks good. Let's check your left as well. A little bit of wax buildup, but in the normal amount. Bony landmark is present. No infection here either. So definitely physiologically your ears are okay. Okay, so we're going to set this aside. I'm just going to press on your ears a little harder than I did before, and I want you to let me know if you have any pain. Okay. And in the front. Okay. No pain. All right. Next up, I'm going to do a quick hearing test.
Okay.
And I want you to keep your eyes closed and just point towards the sound. Okay, good. 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 Perfect. Right, let's take a look at your eyes next. When is the last time you've had an eye exam done?
I believe 1 month ago.
A month ago. And were there any findings or was it just normal?
It was normal. I have to wear glasses when I drive, but that's always been the case.
Okay, good. Any eye discharge that's bothersome?
No.
So go ahead and look straight into the distance. And I'm going to take a look inside of your eye. Okay, that's perfect. Cornea appears normal. Good. Can you look up for me? Down, left, and right. Perfect. And now straight up. Good. Optic nerves are intact in both eyes. All right, I'm going to go ahead and just touch your chest area and try to feel for any lumps or any bumps. Check your lymph nodes and see if there are any physical signs of anything wrong with your chest. So just go ahead and relax for me. I'm going to start by checking the supraclavicular lymph nodes. Can you shrug up for me? Okay, good. You can lower your shoulders and just relax. Just feeling for any lumps or bumps. and checking the mobility of the lymph nodes. Good, supraclavicular. Okay, I'm checking the cervical lymph nodes on your neck next. Okay. Mobile, barely palpable, no inflammation. Okay. Right. I'm going to check your pectoral and axillary lymph nodes as well, right here. Okay, pectoral, lateral, okay, then central in the middle. Nice. So no enlargement noted. Let's do the same over here. Pectoral and axillary, lateral and central. Good. Alright, so no inflammation of the lymph nodes. Okay, let me go ahead and check the dermatomes on your chest. And dermatomes are area of the skin that are innervated by the same spinal nerve root. And usually if there's something going on with the nerves in your spine, that can trigger some abnormal reactions to the rest of your body. So I'm going to go ahead and check the dermatomes on your chest. Okay. So we're going to do a test that's called sharp or dull. May I please have your palm? So this is dull and this is sharp. Can you tell the difference? Good. All right, so go ahead and close your eyes and say sharp or dull.
Dull.
Okay, good.
Dull.
Okay, good.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull.
Okay, very well. So no concerns with the dermatomes on your chest. Ears exam was normal. Eye exam was normal. Any problems with your nose or your throat?
I have not noticed, no.
Okay. So let me go ahead and take a peek inside your mouth. So go ahead and open your mouth and say, oh. Okay. No cankers, no sores, no signs of a throat infection. Can you stick out your tongue for me? Normal tongue color, and touch the top of your, the roof of your mouth with your tongue. Okay, perfect. So normal. And I'm going to just palpate your nose next. Okay. Just checking for any pain, any indentations. Take a deep breath in through your nose and out. Perfect. And then the other one. Deep breath in. Good. Nostrils are not obstructed. I'm not feeling anything abnormal with your nose. So far so good. I'd like you to lay down so I can take a look at your tummy next. Okay. Okay, Mary Rose, is it okay if I lift up your top a little bit and lower your skirt?
Mm-hmm.
Okay. You can keep your arms next to your body. Okay. I'm gonna go ahead and expose the abdomen. All right. Okay. And first I'm just going to visually inspect and check for any skin abnormalities, discharge from the belly button present. No abnormal colors, no signs of dermatitis. I'm going to go ahead and listen to the sounds of your internal organs. And this may be a little cold, so I do apologize. Okay, good. Let's go ahead and breathe normally. Sounds are present in all four quadrants. Normal bowel sounds and no swooshing or gurgling sounds that are abnormal. Good. Excellent. So that's quite normal. Going to go ahead and palpate next. Can you lift your legs a little bit? Yes. Okay, perfect. So that we're not placing any pressure on your abdominal muscles. So go ahead and relax. I'm going to do just a light palpation. Checking for any masses. And checking the size of your stomach. Good, that's normal. The liver on the right side. That's normal. Okay, the spleen. Good. Right. And checking the PMI, the point of maximal impulse, where I'm able to feel your cardiac pulse. Okay. Perfect. All right, let's go ahead and take a look at your legs and feet next. Okay, Mary Rose. I'm going to check your legs for any signs of edema first. Patient does not indicate any pain, and I'm not feeling any swelling of the legs. Okay, no signs of any edema in the calves muscles. I'm gonna go ahead and touch the plantar region and palpate for any pain. Go ahead and inspect in between the toes. Capillary refills within 2 seconds. No nail clubbing or pitting present. Skin is normal on the left foot. No discoloration, no signs of dermatitis. Capillary refills within 1 to 3 seconds. Skin is normal. Nails are normal. Gonna go ahead and take a couple of measurements. About 8.5 inches across the feet, symmetric. 2.5 across the calcaneus region, symmetric. 3 across the plantar region, 3.5. So a little bit of an asymmetry here in the width of your right foot. 4 across, 4 across. Okay, so that's quite normal. 16 inches. 16 inches. And across your ankle, 10.5, and 10.5. Good. So ankles are not swollen and they are symmetric. Okay, I'm gonna go ahead and do the Babinski test. So just relax your leg and your foot. Negative Babinski. Negative Babinski, perfect. All right, I'm gonna go ahead and percuss. Please curl your fingers around my finger. Good. Bring them up towards your head and then down. Good. Is this painful?
No.
How about this?
No.
This?
No.
Any pain here?
No.
Good. All right. Go ahead and curl your toes around my finger. Perfect. And any pain here?
No.
Any pain here?
No.
Good. So leg and feet exam presents normal. Go ahead and stand up so I can take a look at your back. Okay, I'm also going to do a back exam and I'm going to take a look at the scalp in the back as well from this position. And I'm just going to make sure I'm not missing anything on the skin and on the nape area. Okay, good. The scalp is normal. No signs of psoriasis. Taking a look at the hair strand here, which is long, thick, and not easily breaking apart. Do you have any problems with hair loss? Have you noticed any abnormal hair loss?
Sometimes when I get stressed a little bit, but usually only then.
Okay. So hair distribution looks great in the back. Let's see the skin of the neck area as well. Oh, you have one big mole.
Yes.
Have you always had this?
I have, yeah.
Okay, good. Well-defined margins, one color, not seeing any signs of any concern. Okay. doing a visual inspection of the back, seeing a couple more moles. Some of them are red, which is normal. We get moles of all colors. We're worried about the moles that start to present more than one color, which I'm not seeing here. Good. No bruising, no discoloration. Checking for the temperature of the back. Uniform distribution over your spine. You're getting a little bit cooler as we move towards the arms, but you mentioned that's normal for you. Okay. I'm gonna go ahead and listen to your lungs in the back. Okay, go ahead and just breathe normally. Checking for the base of the lungs. Okay. So normal sound. I'm gonna go ahead and feel your spine, starting with your cervical spine. Check for any nodules, anything in between your vertebrae that may be of concern. Okay. Curvature of the spine is straight. Lumbar and thoracic. Cervical spine is straight as well. Okay, wonderful. Not feeling anything out of the ordinary. Okay, I'm going to go ahead and percuss your back. Good. Normal resonance sounds. I'm also going to check the dermatomes in your back. And I have here two objects. One of them is cold and the other one is warm. Go ahead and say if you feel warm or cold.
Cold.
Okay.
Cold. Cold.
Okay.
Cold. Cold. Cold.
Okay. So a little bit of mixing of the sensations, hot and cold. Let's go ahead and see if you can tell the difference between sharp or dull.
Dull.
Okay.
Sharp.
Good.
Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Dull.
Wonderful. Okay. let's go ahead and get dressed and we'll discuss the results.
Okay.
Okay, Mary Rose, this concludes the head to toe assessment for today. I did notice a little bit of sensorial confusion on the back. You mixed the hot and cold a little bit. That can be normal. You got the sharp or dull right. But I would like to have a follow-up examination of your back to see if there's anything going on there that I may have missed today. Other than that, normal vital signs. Your head, ears, nose and throat, mouth, everything was okay. Your legs and your feet were normal too. I would recommend you take some magnesium supplements that usually help with sleeping, and it's going to help relax you a little bit and maybe relax a little bit of your muscles. I think the tightness in your chest can be associated with just overall soreness of your muscles. When I was palpating your back, I could feel some knots in there. And I would continue drinking a lot of water and maybe give the swimming a little break just until your ears go back to just being normal and not giving you any trouble whatsoever. So maybe a couple of weeks and see how that goes for you. And do you have any questions for me?
I don't think so, no.
All right, I'd like to see you back in a couple of weeks so that we can follow up on your symptoms.
Okay.
Wonderful seeing you today.
Wonderful seeing you too.